Hello everyone, welcome to Pasteur Institute Shillong. We are the Nodal Institute for Diagnostics and provider of both essential service and public health leaderships, supporting and strengthening programs that protect the public health laboratory and the service needed to support informed policy decisions. Pasteur Institute comprises of the integrated public health laboratories such as microbiology, pathology, biochemistry and molecular laboratories, besides having the drug testing labs and the ISM testing lab system. Our mission and visions are to provide accurate and timely diagnostic to our client using state-of-the-art technology and delivering exceptional customer services, as well as becoming the leading providers of diagnostic services in the state, recognized in our commitment to quality, innovation and excellence in patient care. In the following videos, we'll be learning about the different type of rapid diagnostic tests, also commonly known by its shortened name RDTs, their basic principle, method of and sorting the kits. Rapid diagnostic tests are, as its name suggests, kits that are used for diagnosis infections or diseases within a short time period, usually within 30 minutes. They are used in point of care settings, that is, directly at the bedside of the patient, having minimal need of other requirements such as equipments and other consumables that are usually reliable in the tertiary level laboratory. They provide reliable results and have helped optimize clinical care and improve patients' outcomes, especially in the peripheral healthcare settings. They have been developed and standardized in such a way to make diagnosis affordable, less expensive and rapid, and the procedures and techniques are user-friendly, rapid with good sensitivity and specificity. To correctly detect diseases require no special requirement and easily deliverable at the site of testing. RDTs are usually uses the format of nucleic acid amplification or antigen and antibody reactions. All the RDTs that are used are for detection of either antigen or antibody using the special characteristics of antigen and antibody reactions. The principle behind the mechanism of such kits is immunochromatography, which is a combination of chromatography and immunoassay. Due to the capillary action of the material used in the RDTs, which is most commonly a nitrocellulose membrane, the liquid sample, which is dropped into the sample pad at one end of the device, is carried to the other end of the device and made to pass over the immobilized antigens or antibodies, wherein the specific antigen-antibody reaction takes place. This leads to the separation of specific target analyte, that is either antigen or antibody, from the patient's blood, which will help in the interpretation of the test result. For example, if the aim is to detect hepatitis C antibodies in the patients, then hepatitis C antigen will be immobilized over the nitrocellulose membrane, so that when the patient's blood is added to the sample pad of the device, there will occur interaction and binding of the hepatitis C specific antibodies in the patient's blood and the hepatitis C specific antigens as the blood passes over the nitrocellulose membrane. The RDT will flag positive for such a sample. If there is no hepatitis C specific antibodies in the patient's blood, there will be no antigen-antibody reaction. Thus, the RDT will show no reaction and flag negative. Despite having high sensitivity for detecting disease correctly, most RDTs that flag positive for certain diseases require further tests for confirmation, which are usually either by PCR or by ELISA tests. Nevertheless, RDTs have proven to shorten time for diagnosis, thereby aiding in clinical decision making and overall improving patients' clinical outcomes.
For every RDT test that we are going to perform, blood will have to be collected first from the patient. Before collecting blood from the patient, a patient will come with requisition form for whatever test that needs to be done. The first step that you need to follow is to go through the patient's requisition form that will be coming along with the patient. Certain points need to be kept in mind when we go through a patient's test requisition form. First of all, we have to confirm the name, age and gender of the patient with the requisition form that comes along with the patient. The next step, we look at the lab ID or the hospital ID that will be mentioned in the test requisition form. Next, we'll look at the test that's going to be required and we're going to count the number of tests present for each requisition form. We're going to map out what tests is required, and we are going to separate the different types of consumables that will be required for each test. Once we have correlated and confirmed the data of the test requisition form with the patient, we're going to call the patient and tell the patient to sit in the chair comfortably, and we're going to ask the patient to extend both of their arms. You're going to inspect the forearm, especially the cubital fossa, for venipuncture. Next, you're going to take your tourniquets and you're going to apply at least 10 centimeters above the cubital fossa of the arm, just enough pressure so that it doesn't cause pain to the patient. Next, with the help of cotton that's soaked in 70% alcohol or in normal saline, whichever is feasible in your setup, and you're going to rub the area with it in an inward to outward fashion, and 2 or 3 times depending on the need. And take a syringe, 2 ml to 10 ml, depending on the number of tests that you're going to perform. Most preferably and most comfortably, if you are not confident in your venipuncture method, you can use a 2 ml syringe. We advise that you use at least a 5 ml syringe so that you do not cause inconvenience to your patients when you prick a patient multiple times with a 2 ml syringe. After you've taken out the syringe from the skin of your patient, you're going to press that area of puncture with a dry cotton for 2 to 5 minutes in order to stop the bleeding. Transfer the blood from the syringe to the required colored cap vials depending on what test is being done. In this video, since we are going to be showing tutorial for how to use RDTs, here we mostly use either serum or plasma. For serum, you use a red capped Vacutainer sterile vial, and for plasma, you can use a purple capped or an EDTA sterile Vacutainer vials. At least 1.5 to 2 ml of blood is required for a red capped vial, whereas for a purple colored EDTA vial, you are going to fill the vial up to the marked area in the vial, which is most commonly up to 2 ml of blood. For an EDTA or purple colored Vacutainer vial, it is advised that you rotate the vial upside down multiple times, up to 4 to 5 times, in order to prevent coagulation of the blood, so that the blood can mix with the coagulants that's present in the vial. Once you receive the sample in the lab, there are certain steps which are common to all of the RDTs that we are going to be showing in the tutorial today. The first step is you have to check the integrity of the sample. First of all, look for any kind of leakage or any break in the vial or any break in the cap of the vial. You're going to look at the labeling of the vial also as well, so that it matches the requisition form that you receive. The next step, you're going to look if the sample is hemolyzed or not, because for hemolyzed samples, we avoid as much as possible since it gives high false positive results. Next, you're going to look if the sample is turbid or cloudy. If it's too turbid or too cloudy or milky looking, it shows that the sample is lipemic, which cannot be used for such test again because it gives false positive or false negative results. After you have checked the integrity of the sample, you're going to prepare the sample next. For blood sample that's collected in red capped or purple capped vials, you're going to centrifuge the samples at 3000 G for either 10 to 15 minutes. To be noted that for red capped vials, in facilities that do not have a centrifuge equipment, you can allow the sample to stand for 30 minutes to 1 hour in order to allow for the blood to clot and the serum to separate. You can use this serum for your test. The third step is you look at your test kit box that you're going to perform, and you look at the integrity of that box, if it's either broken or the seal is broken if you have taken it out newly. You're going to look at expiry date and the lot number. Note it down. Please do not use any expired kits. The next step, you look at the storage conditions of your test kit. In the box itself, it will be mentioned the storage condition for particular kits. There are certain kits that you can keep in 2 to 4 degrees Celsius, that is in the refrigerator, and there are other kits that you can keep at room temperature, that is 20 to 40 degrees Celsius. But there are certain kits wherein the temperature lies between 4 degrees Celsius to 30 degrees Celsius. So we advise that you keep it in room temperature. The fifth step, please make sure you go through the manufacturer's insert manual before performing any tests. Read it carefully from introduction to result interpretation so that you do not fumble and you do not make any kind of mistakes. For the information of everyone viewing this particular tutorial, different type of tests can be conducted using different type of brands or manufacturer, albeit the principle is still the same. Please go through your manufacturer insert kit thoroughly and carefully and follow it step by step. The last step that is common to all testing procedure is the cleaning of your working surface area. Clean your working surface area before conducting any tests and after conducting any tests with the help of 70% alcohol or any kind of disinfectant that is provided to you. We advise that 70% alcohol is enough to clean your working surface area. The direction of cleaning your surface area should be either from one side to the other side or from top to bottom in a unidirectional pattern using either cotton swab or a tissue paper or any kind of absorbent material that is available in your facility. An important point to be noted, for test kits are stored in the refrigerator. The reagents and test kits should be allowed to bring to room temperature first before performing any kind of test.